Welcome to The Explainer. Today, we're tackling something that affects millions of people, panic disorder. We're going to look at it from two really different but surprisingly connected angles, the world of modern medicine and the ancient wisdom of yoga.
So before we can even talk about the disorder, we have to get a handle on the panic attack itself. If you've ever had one, you know exactly what I'm talking about. If you haven't, just imagine, out of absolutely nowhere, a tidal wave of pure terror just washes over you.
And it's not just in your head. Look at this list. Your heart is pounding out of your chest, you can't catch your breath, you feel like you're choking, you genuinely think you're losing your mind, or, and this is so common, that you are literally about to die. It's so intense that most people's first stop is the emergency room, absolutely convinced they're having a heart attack.
Okay, so that's one terrifying event. But how does that experience transform into a full-blown diagnosed disorder? Because it's not just about having a single attack.
And this right here is the crucial difference. The disorder isn't really the attack itself. It's the shadow it leaves behind. It's that constant nagging fear of, what if it happens again? That fear is what starts to run your life. You start avoiding places, situations, you're always on high alert. And don't think for a second that this is some rare thing. We're talking about up to 4% of the population. That's a huge number of people. And it often kicks in during late adolescence or early adulthood, right when you're supposed to be figuring out your life.
All right, let's put on our lab coats for a second and look at this from a medical standpoint. What do scientists think is actually going on in the brain when this happens?
Well, one of the leading theories is just fascinating. It suggests that deep in your brainstem, you have this kind of biological smoke detector. But in people with panic disorder, that detector is way too sensitive. It misfires and screams, "We're suffocating," when everything is actually fine. And that false alarm is what triggers the whole cascade.
And this is how it feeds on itself. It's a terrifying feedback loop. It can start with something completely harmless, like your heart skips a beat, which happens to everyone. But your brain goes, "Oh my God, what was that?" It misinterprets it as a catastrophe. That triggers your brain's fear center, the amygdala, which then floods your body with adrenaline. And guess what? Adrenaline makes your heart pound even harder, which just confirms your brain's initial fear. It's a spiral.
So, how do you break that cycle? Well, the medical toolkit has two main strategies. You've got medications like SSRIs, which basically help turn down the sensitivity on that faulty brain alarm. Then you have psychotherapy, and the gold standard here is CBT, which helps you retrain your thought patterns so you don't make that catastrophic misinterpretation in the first place. Now, one of the most powerful techniques in CBT is something called interoceptive exposure. It sounds intense, but it's brilliant. You work with a therapist to purposefully make yourself feel those sensations you're afraid of. Like you'll spin in a chair to feel dizzy, or breathe through a straw to feel short of breath. By doing this in a safe space, you teach your brain, see, this feeling isn't dangerous. You're basically breaking the link between the sensation and the panic.
Okay, so let's shift gears. We've seen how medicine approaches this from the outside in, with drugs and therapy. Now let's look at an approach that works from the inside out.
From a yogic perspective, a panic attack isn't a brain error. It's seen as a massive, sudden disruption of your prana, which you can think of as your life force energy, your breath. And notice the connection there, right? Medicine talks about a suffocation alarm, while yoga talks about a disturbance of the breath. Both traditions are zeroing in on the same fundamental process going haywire. And the tools yoga offers are incredibly direct. Pranayama, which is just a term for breathing exercises, can directly tap into your nervous system. A long, slow exhale literally tells your body that it's safe to calm down. Then you have asana, the physical poses, which help you feel grounded and stable. And meditation teaches you to just notice sensations without freaking out about them, to see them come and go without attaching a story of doom to them.
So you can probably see where this is going. This isn't about choosing one path over the other. The real magic happens when you combine the best of both of these worlds.
This table just lays it all out so perfectly. Modern medicine is fantastic for targeting the attacks head-on and giving you pretty quick relief. Yoga is more of a long game. It's about building this deep internal skill of self-regulation. And look at that last row, relapse risk. With medication, it can be a problem if you stop. But with a sustained yoga practice, you're building skills that stick with you for life. So you can imagine how powerful this combination is. You might use medicine or CBT as the firefighter to put out the immediate blaze. That gives you the stability and the breathing room to then start practicing yoga, which is like fireproofing your entire system for the long haul. It's a fantastic one-two punch. And we need to care about this because this isn't a small problem. Panic disorder has a massive impact on society. It clogs up emergency rooms, costs the healthcare system a fortune, and it can absolutely wreck a person's quality of life, their career, their relationships, everything. So finding better, more holistic ways to treat it is incredibly important.
And that kind of leaves us with a final question to chew on. As we move forward, maybe the goal of mental health care shouldn't be to find that one magic bullet, that single cure. Maybe it's about helping people build their own unique, personalized toolkit, one that empowers them to skillfully manage this incredible, complex connection between their mind and their body.